Welcome back to the Pelvic Health Summit. I'm sitting here with Dr. Seth Berger, a psychiatrist who received his degree from Columbia University. While there, he was the chief resident in the adult residency program, and he continues to supervise and teach the residents in that program. And he also sees patients at his private practice on the Upper West Side of Manhattan. So tell us a little bit about your practice and approach.
Yeah, so as a psychiatrist, I see a wide variety of different things. Anxiety and depression is some of my expertise. I also treat insomnia, ADHD, chronic life stressors, and recently I've been seeing a lot of people with comorbid pelvic floor pain, and I've become really interested and fascinated by it. So my approach is individualized based on the person who comes in. So I will always see them as a whole person, and I will think of them not only as what's in the office, but what's going on outside of the office. And together we will come with an individualized treatment. Sometimes that's CBT therapy, sometimes that's supportive psychotherapy, and other times it might be a combination with that of medication management. And every person is very different the way that we think and treat them.
So I know that many of the people watching, also myself, people who have experienced pelvic pain have been told that they're crazy or it's all in their head or there's a lot of shame associated with their condition. Would you mind speaking to that?
Yeah, so that's one of the common myths and misconceptions of pelvic floor pain. And I think that dates back to many years ago when people were struggling with pain and they didn't really know what it was or what the cause was. So when you go see many physicians or doctors or therapists and everybody gives you different answers, it makes people think that maybe this is in their head. But luckily, over the past 10 years, we've learned so much more about pelvic floor pain that we're able to provide a really good treatment now. And it's a combination of the actual pain that's going on and anxiety and mood. And there's such a high comorbid anxiety and depression in pelvic floor pain, which makes sense, one, because of not really knowing where the pain's coming from, what's happening, what's the cause, and also that there's so much uncertainty in the pain. Is it going to come today? Is it going to start tomorrow? When's the flare going to happen? What to do? So I think because of all those things, the anxiety rate's really high. And it's not all in one's head. There is so much real, true pain there. And that's why it's really important to have a really good approach of many different people and the multidisciplinary approach of having a good physiatrist or OBGYN or subspecialty in surgery or whatever it is, as well as with physical therapy, and taking a step back and looking at it from the mental health field to get a better idea of what's going on and how we could tackle it all together.
Thank you. That was really helpful. So I know that therapy can often be taboo, as are pelvic health and pelvic pain conditions. What are some ways you can advise the people listening to open up to the people in their lives so they can explain to them a little bit more about what's going on? With pelvic floor stuff, you can't always see it. So do you have any recommendations for that?
Of course. I think that's a really good question, and a common problem is how do you involve family and friends? And I think that's one of the most important things to do, is to be able to talk about it. And not to talk about it when you're in a flare of pain. It's really important to talk about it ahead of time. Almost everybody who has pelvic floor pain is suffering in one form or another. I mean, it affects all different modalities in one's life, whether it's the occupational sense, whether it's financial, social. Can I spend time with friends and family? Am I going to be able to work in order to pay the bills? Am I going to be able to go outside of my apartment or house today? It really affects every single part of one's life. So it's important for the family members to really be able to kind of understand this, as well as friends. So I think one of the most important things is for family and friends to be informed. Now, there's many different ways of becoming informed. One would be by talking to the person who's suffering from pelvic floor pain and trying to get their sense of what's going on. And the other thing is there's so much knowledge out there in the community, on websites and forums and books. So it's helpful in order to become empathetic. It's important to really have a better understanding of what's happening. So I would encourage family and friends to be able to read up on this and to know more about it so that they can talk about it with their loved one or friend. And then the other part too is to have a plan. I think it's really important for family and friends and supportive people in one's life to really have a better sense of what to do in a crisis. And that's always better way ahead of an actual crisis. So sitting down and coming up with, what should I do if you're in a lot of pain? What should I do if you can't get out of the apartment? How much should I push you? What can I do that helps you? What can I do that doesn't help you? And this way, if you could come up with a plan together, It makes it much easier to approach it in an actual more urgent situation.
Thanks, that's super helpful. Do you have any resources, especially online resources and books, that you can recommend that could help with this?
So again, those are great questions. The Endo Fund has tons of different outlets and sources if it's endometriosis. I would say that the best people for this is with the pelvic floor pain, the physiatrists, the OBGYNs. They have a lot of information based on what specific pelvic floor dysfunction somebody has. In terms of, from a psychiatric standpoint, I think that there's the NAMI, the National Alliance of Mental Illness, that has tons of different resources on the anxiety and depression and support groups. And then there's also tons of apps on one's phone that could really be helpful for family and friends to recommend to those loved ones suffering. The one that I recommend the most is actually called Headspace. It's a meditation tool that really does help people when they are overwhelmed and stressed and anxious or in a lot of pain, just to work on their breathing and to be mindful and to try to come up with a way to have their personal space so that they're able to better digest some of it and to better take a step back and to deal with some of the stressors in their life.
What are some other self-care tips you have for those at home that can help support their mental health?
Yeah, so one of the studies I really like to look at is a study that involves mice that have endometriosis. And while not all pelvic floor pain is endometriosis, it does kind of give one a better understanding of things that we can do in terms of self-care. And in those mice, to make a long story short, that suffered from endometriosis and also anxiety and mood symptoms, what they noticed was that if the mice were around lots of other mice, that helped their anxiety and their pain. If there was novelty items that were around them, it helped. And then large open spaces really helped. So I like to use those 3 different avenues to talk with people about what they can be doing in terms of self-care. And in terms of having more mice in the cage and more social interactions, yes, that's good to have social supports and people around and to talk to people. But also there's a whole social network that you could use online. And that's really important too. So I think that's very important. In terms of novelty items, there's many different apps. There's many different ways of thinking and stimulating your brain, whether it's reading or writing or watching things on TV or getting outside and talking to people. I think that can be really helpful. And then open spaces in New York City is sometimes hard to find, so I really recommend going outside of your apartment, going out into an open space, going hiking if you can do things like that, or going out into nature, going out into larger areas. I think that is also really helpful. Then the other 2 different ways of coping with some of the pain is exercise and meditation. Now, exercise is very difficult because a lot of people are in so much pain, they're not able to exercise, or they don't feel like they're able to do even 15 minutes of something. So I always suggest finding an exercise routine that one's interested in, whether it's going on walks, going on a bike, whether it's doing jumping jacks, going to a spin class for a minute or 2, something that one finds really enjoyable. And trying to do that just for a few minutes at the beginning. Don't set the bar too high that you can't accomplish it and then you feel really bad about yourself. So go for 1, 2, 3 minutes. And then the other one is meditation, that try to find something simple. Try to find something that you can do just for 3, 4, 5 minutes, which is why I really like Headspace, but there's many different other meditation or yoga techniques that one can do also to help with self-care.
For those who have partners who are suffering from pelvic pain, can you give us some recommendations about how we can speak to those partners, and also if we have a partner who we suspect has a pelvic pain condition, especially if it's a man, can you give us some pointers into how we can start that conversation so they might be able to find some better treatment options?
Yeah, so I think that support and validation go a really long way. So just starting the conversation by saying, I'm here for you, that I can't tell, I don't know if something's bothering you, but I could sense something is a little bit off. If you want to talk about it, let me know. I'd love to have that conversation. That's always the best way, is to not to push somebody too hard, but just to let them know that you're there. And then the other thing is for the partner to do some research on their own. Try to find what supports are in place in the community. Who can they talk to? So then you could actually have some good concrete evidence that you could help provide them with. And the third is trying to get them out of, this isolation that a lot of people end up in when they are, suffering by themselves. to encourage them to go on walks with them, to go do errands with them, and to spend time with them. And while they're doing that, just to let them know again how much that they care about them and how much they really want to help them. So if something's bothering them, they're there to listen and also to help when possible.
Awesome. Can you talk a little bit more about some of the mental health conditions associated with pelvic pain, or just some other symptoms that your clients have?
Yeah. So I think that one of the most common things that we see is this emotional roller coaster. And what happens is that, there's so much uncertainty in what's going to happen with the pain and how is it going to affect one's life. And as a psychopharmacologist who specializes in anxiety and mood, I see all the time that chronic life stressors, whether it's interpersonal stressors or occupational stressors, or stressors dealing with financial problems, that makes somebody anxious and depressed. So here you have somebody who has pelvic floor pain, and that is a chronic uncertainty and a major stressor. And that's really going to affect one's ability to decide, can they go out one day? Can they go to work? Can they spend time with people? So that by itself is going to make somebody have more shame and guilt about what they can and cannot do. It's going to affect their self-confidence. It's going to affect their self-identity. And then ultimately what happens is they hear that you need to exercise, you need to get out, and then they try to do some of these things and they can't. And that leads to avoidance and isolation. And we know that avoidance and isolation actually makes pain worse. There's an important parallel between pelvic floor pain and anxiety and depression. And from the biological standpoint, we know that a lot of the neurotransmitters are related, that both of them, when pain is high, that oftentimes the serotonin is low, norepinephrine is low, it affects the cortisol in one's body. There's just a lot of overlap there. So I think that it's important to realize that there is real biological causes for this, which make oftentimes people more hypersensitive. People that are in pain are more hypersensitive to anxiety and depression, and people that have anxiety and depression are more hypersensitive to pain. So I think that oftentimes there's just so much overlap that trying to target one of them, if not both at the same time, can be really helpful for both the pain and the anxiety and depression.
Thank you. I think it's fairly obvious how getting support from a mental health professional is so important, but can you tell us some questions that we can ask ourselves that will let us know if it's kind of like, I need to go to a psychiatrist? Some indicators that we can be on the lookout for if something gets a little bit too much, how we can know and how we can reach out.
Yeah, so I think that it's always important to have outlets of support. So, sometimes people are overwhelmed in their everyday life, and even they can benefit from having a therapist, whether it's a psychiatrist or a psychologist. I think if the anxiety gets overwhelming or the mood is so low that it's interfering with your functioning. You're functioning in your relationship, you're functioning at work, you're functioning leaving your apartment or deciding what it is that you're able to do because of this overwhelming anxiety and depression, that's when it's time. You don't have to wait for it to be so bad. You want to get ahead of it before it affects your functioning. And that's why I think it's important to always be talking to somebody and having those outlets. But if it is affecting your life in one form or the other, that's when it's really important to get the help that you need.
Awesome. So for those people watching who aren't in Manhattan, can't come and see you, what are some places and online resources where we can find other specialists and psychiatrists who can treat people who also experience chronic pain?
Yeah, so I wish I had that answer, because I feel like in terms of the psychiatrists and the psychiatry community, there's a short supply, and it's unfortunate how the demand is so high, and the people that go into the psychiatric field, it just can't meet the possible demand. But I think that there are a lot of resources online, and each state is different. For example, in New York, we have NYC Well. It's a website that you go on online, and then you can put in whether your demographics, what's going on, some of your insurance information, and they can try to find people, therapists and psychiatrists that would be able to see you and/or clinics. But I would say to start with primary care doctors. I mean, they're supposed to be the people that are in charge and the point person. So I would say that if you're in a community that doesn't have that many psychiatrists or psychologists, to go to your primary care doctor, let them know what you're experiencing, and see who they would recommend. And that would be a good first place to start.
Can you tell us how you decide what type of therapy or treatment you should provide an individual?
Sure. So, definitely everything is individualized, and I don't think that there's one treatment that works for everybody. but I think it's important to think about what the person's specific goals are, where they are on their journey, on their personal journey throughout life, what type of treatments they've had before in the past, what's worked and what hasn't worked, and also, what are their strengths and what are things that they would be really good at in terms of utilizing some of those to work with. So with all that being said, in pelvic floor pain, I have worked with a lot of people in the cognitive behavioral therapy mindset, and that's not the only way to be working with somebody, but that is something that the evidence does show is very helpful. And that focuses on the here and now, and it relates to how one's thoughts, feelings, and behaviors are all connected. It takes a step back and looks at people's cognitive distortions, if they're not looking at things in the right way, or they have some kind of catastrophization where they're catastrophizing and always thinking the worst, or they have irrational thoughts, and it tries to really identify some of those and come up with well-balanced thoughts or ideas that have a different way of looking at things to kind of better help their mood and better help them be able to tackle some of those different roadblocks that are going on in their life. It also looks at avoidance and tries to come up with behaviorally things that one can do to cope with that avoidance and to face it head on. So that doesn't mean that everybody really needs cognitive behavioral therapy. Some people would rather more of a supportive approach, but I think the most important thing in any therapy is to identify clear goals and to always trying to be working towards those and revisiting those. And medication can be very helpful, but medication doesn't solve anybody's problems in terms of the life stressors or the other things that are going on in one's life. So while medications are helpful for both anxiety, depression, and comorbid pain, it's important to really think about what else can be put in place to give somebody the best chance of succeeding, and potentially think about medications in combination with therapy.
Thank you. Very informative. Can you tell us some success stories of patients that you've worked with?
Sure. I mean, there's definitely lots of success stories. That's how I got into pelvic floor pain, because I find it so rewarding. And about 2 or 3 years ago, there were 2 women that I saw in the same week that had endometriosis as well as anxiety and depression. And I was working with them the same way I would work with anybody that has anxiety and depression, and focused in on that, understanding some of their pain component. And over the course of several months, their anxiety got better, their mood got better, and their pain got significantly better. And I wasn't sure if this was by luck or coincidence, or if it talked to the mind-body connection. So when I was speaking to some of the referral sources that sent them in and other people, and were reading more about it, I started really believing that there is such a strong relationship in those two, that I was more and more interested in it, and I was seeing more and more women and men with pelvic floor pain as well as anxiety and depression. And over the past few years, it's been continuous. There's no question that when you treat the anxiety and depression, the pain gets significantly better. And a lot of the pelvic floor doctors that have been sending me patients, they've noticed that as well, the connection between the mind and the body. And it's unbelievable and so rewarding to see how much improvement can be made. And it's a multidisciplinary approach where the pelvic floor doctors are working on some of the procedures and some of the different aspects from their point of view. Then there's the physical therapists that are working with the people as well. And then I look at it from the anxiety and depression perspective. And overall together, the improvement is just unbelievably remarkable.
Awesome. Is there anything else you'd like to share, perhaps where we can find you online?
Yeah, so I think that it's amazing how much we have grown in the pelvic floor field over the past 10 years. The resources that we have, the doctors that we have, the knowledge that we have, it's just, overwhelming and unbelievable, because, 15 years ago, people would not be able to get that same amount of treatment, and they wouldn't have the same knowledge base. So I'm very optimistic about where everything's going. And I think that one of the aspects in terms of positive prognosis science is really one's optimism, that if they come and they approach us and they're optimistic and they're motivated, people do get better. And I think just talking about how much the field has grown over the past 10 years should make people optimistic. And yes, you could find my information on Psychology Today if you search Dr. Seth Berger, MD. And it's just, I'm so happy to be part of this field because it is so rewarding and people do get so much better. So I'm very happy to be here today.
Thank you so much.
Thank you.
We will link all of Seth Berger's information in the group so you can check it out. Thank you so much for joining us. Now I'd like to hear from you. Please share with us one takeaway from the interview in the comments below. Give us a like and share this group with someone who you think will benefit. Thank you.